Hello friends, welcome back to my channel. Today I am going to discuss with you regarding the visual infusion phlebitis, that is also called VIP score. The visual infusion phlebitis score is a very popular tool recommended by RCN, that is Royal College of Nursing, for monitoring infusion sites. This tool was developed by nurse Andrew Jackson. The tool help healthcare worker so that peripheral IV catheters can be removed at the first indication of phlebitis. So this is a tool which is mainly used to assess the IV line, that is peripheral IV catheters, so that initially we can check the site that is it patent or not, and then if there is any problem in the IV site, we can remove the angiocath or IV catheter. Okay, the VIP score is accepted as the international tool for the early recognition of infusion phlebitis and allow for the promote action to be taken to avoid thrombophlebitis or a line related local infection or systemic septicemia. And VIP score is accepted as an international tool. So with the help of this tool, we can early detect the infusion site or any phlebitis, so that we can take the action to avoid thrombophlebitis or any septicemia. Next is device should be reviewed at least twice daily and the VIP score recorded. Okay, so with the help of VIP score, we can also check the device at least for 2 times a day, or with this we can also record the VIP score to get a better result for the IV line. Okay, next is peripheral IV devices and phlebitis. First is peripheral IV devices are cannulas or catheters inserted into a small peripheral vein for either blood sampling or therapeutic purpose, such as administration of medication, fluids, or blood products. So these peripheral IV devices mainly used for sampling and as well as for administration of any kind of medications or fluids or blood products. Okay, so this is the devices. So mainly another definition is phlebitis. So what is phlebitis? It's a mainly inflammation of a vein. It can be three types like mechanical, chemical, and infective. So mechanical, mainly movement of a foreign object within a vein causing friction or puncture, or anything which can be enter to the body like foreign objects into the vein, so it will cause a phlebitis. Next is chemicals, caused by the drug of or fluid of being infused. Any kind of drug which is interaction of any drug can cause the chemical phlebitis. And next is the infective, like caused by any microorganism. So that's why IV line must be used as a sterile way. Okay, next is thrombophlebitis. So thrombophlebitis is one or more blood clot in a vein that causes inflammation. So phlebitis is just a inflammation of the vein, but thrombophlebitis is the one or more blood clot is present in the vein. It will cause an inflammation there, so it is called a thrombophlebitis. Okay, so now I will tell you regarding the VIP score, how we can grade it, like from 0 to 5. Okay, so the first one is 0, when the IV line is fully healthy, like IV site appears healthy, there is no any pain, any inflammation, any redness, so that is called a healthy IV line. Okay, so we can give 0 score for that. There is no any sign of phlebitis, and in this case we just only observe the action which is taken, that is observe the cannula only. Okay, next is grade 1. In grade 1, one of the following is evident. Mainly there is slight pain at the IV site or slight redness is there. From both, one can be there, any pain or either redness, and the score will be 1. And in this possibly first sign appear. In this case, we can just observe the cannula and documented it, and that course should be checked at least every 6 hourly. Okay, so next is second grade we can give when there is two of the following signs are evident, like at the IV site there may be pain or arrhythmia, that is redness or swelling can be appear. In this, early sign of phlebitis appear and we can resite the cannula. Site change must be there in this case. Okay. Next is grade 3. In this, all of the following signs are evident, like pain will be there, arrhythmia will be there, or induration, that is hardening of the tissue can also appear in this case. So we can give 3 grade to this and there will be mid stage of the phlebitis. Okay, in this case we can resite cannula and also consider some treatment. Okay, so this is a grade 3. Next I will tell you regarding the 4th grade. In this grade, all of the following signs are evident and extensive. Means there can be also be extension of the signs, like pain can be worsen. Okay, pain along path of the cannula. Second is arrhythmia. Any redness can also be there. Then induration, like hardening of the tissue can appear, and the palpable venous cord can also appear. So these all are the signs can be seen in 4th grade, and that is called advanced stage of phlebitis or the start of thrombophlebitis. Means more than 1 or 2 blood clot appear on the vein in this stage. In this stage we can do what prevention we can take, like resite the cannula. Next is consider treatment, like antibiotic treatment can be started. Along with this, culture can also be taken. Okay, next is 5th stage, that is all of the followings are evident, like pain along path of the cannula, then arrhythmia, and then is induration and palpable of venous pain. Along with this, one more symptom, that is pyrexia can also appear. In this means there can be a septicemia. The chances of septicemia can be more in this stage. Okay, 5th stage, and here is it is called advanced stage of thrombophlebitis. And the action can be resite cannula kar sakte hum, and then is initiate treatment, like we can start antibiotics and also taken cultures. Okay, so these are the stages which is mainly seen in VIP score. With the help of VIP score we can assess this scores. Okay, stages. Next is things to be keep in mind while assessing IV cannula. First is hand must be washed and clean with alcohol hand rub, including correct use of PPE, that is protective preventive equipments. Okay, so hand must be washed before touching the IV line. Okay, IV cannula. Okay. Then next is use 2% chlorohexidine in 70% alcohol for skin prepare. Also for scrubbing the hub every time the device is assessed. One thing is there, when we use the skin, first of all prepare the skin with the 2% chlorohexidine, 70% alcohol, and also always scrub the hub when we can use the IV cannula. Each time we have to clean with the alcohol swab. Okay, next is skin must be swabbed for at least 30 seconds and allowed to air dry at least 30 seconds before the device is inserted. Okay, so we can first prepare the skin and after that clean the skin with the swab also and left 30 seconds there only, so that air dry will be there for 30 seconds, and then we have to insert the device. Okay, do not repalpate the site once the site has been allowed to dry. It's most common when we clean the skin and after again we can use our hand to repalpate. That is not a proper practice, so please don't repalpate the site. Okay, apply a transparent cannula dressing which allows site to be inspected and reduce infection risk. Always use transparent cannula dressing so that we can easily assess the site, any redness or swelling. Okay, next is always consider the use of an extension set for improved comfort and to ease access to line. Okay, so for this extension set like BD connectors and all we can use to the line. Okay, next is flush the line to check patency of the cannula, and that is no resistance, pain or swelling. So always flush the line with 0%, 0.9% line flush or heparin flush, that is 100 international unit per ml. Pre and post both time. Okay, then is peripheral IV devices should not remain inserted for more than 96 hours. So these lines can be used up to 96 hours only. Okay, after that we have to remove and reinsert the next cannula. Next is VIP score should be recorded per shift or at least twice daily. Okay, so our record of VIP score per shift or at least for twice daily. Okay, then change dressing if it is soiled or remove cannula if VIP score is more than 1. Okay, if any redness is appear or any swelling will be appear, one of this pain or swelling, we can remove the cannula or change the dressing if the dressing is soiled also. Okay, apply pressure using sterile gauze for 2 minutes until bleeding no longer evidence from puncture site. Apply plaster or sterile gauze and adhesive tape. Okay, then discard waste and sharp appropriately. So these are the things to be keep in mind while assessing the IV cannula insertion or handling IV cannula. Okay, so guys, I hope to understand this all the topic. So thank you for watching my video. Thank you.